Hello everyone, my name is Dr. David Gustitus from Whole Body Health in Vienna, Virginia, and welcome to Autoimmunity, Finding Solutions That Last. Ever since I was a little kid, I struggled with a poorly functioning immune system. I had terrible asthma from the time I was born. I had every cold, every flu, and I had allergies all year round. I'd leave a trail of tissues everywhere I went so people would know that I was there. Not intentionally, but that's just what I did as a little kid. And I would ask my mom, Mommy, do you have trouble when you breathe? Is it difficult for you? And she'd say, no. And she'd say, why? Well, for me, breathing was like breathing out of a straw. Asthma constricted my airways and I had trouble all the time. Later on in life, when I was an adult, I had 3 concussions from playing soccer. And going through a divorce gave me a tremendous amount of stress. And why I share those is because those also shaped my immune system in ways that I'll talk about later. But what those experiences did do for me was it gave me the need as well as the opportunity to seek solutions, to find answers, to help myself, help my family, and help my patients to achieve the breakthroughs that we were all looking for. You're in the right place if you worry that you or a loved one might have autoimmunity. Or if you've been diagnosed with an autoimmune condition and you're frustrated with the medical options that are available. Or if you have poor health and you've been struggling for many years by missing important life moments that you want to get back to. That's why I'm here today. I'm excited to talk about this critically important information that you or your loved ones could benefit from to find answers, to find out what's going on with your health and to get your life back. I'm going to share with you our root cause approach that has helped me, help my patients, help all of us to find answers, to find ways to not miss those important life moments anymore, and also to avoid dangerous medications. Today we're going to discuss these 5 important areas. Number 1, the rapid rise of autoimmune cases worldwide. Number 2, do I have it? We'll go over symptoms and risks that can contribute to whether or not you have autoimmunity. Number 3, we'll talk about causes of autoimmune diseases. 4, we'll go over the common medical treatments. And 5, we will discuss my root cause healing strategies. Now, you might be someone like Paige. Paige was an incredibly talented and driven young woman, but she suffered from chronic fatigue as well as pain, swelling, and inflammation throughout her body. Her poor health condition unfortunately kept her from pursuing her entrepreneurial dreams. She came to me and she was completely beside herself. She had almost lost hope. She had been to every doctor that she could think of, and nobody could provide her with any answers. We were able to find out that she had an autoimmune condition called Hashimoto's thyroiditis, that it wasn't in her head as her doctors had told her, but rather it was due to chronic stress, a poor diet, and her inability to exercise, that all threw her body and her immune system out of balance and caused her to be inflamed and fatigued. After 3 months of working together, we helped her reboot her lifestyle, find her inner balance so she can get her energy back and get back to pursuing her dreams again. Or maybe you're like Paul. Paul's an avid cyclist. He developed knee swelling out of the blue that caused him pain and kept him from being able to ride his bike. But it was not due to a joint injury, which you might think. After a thorough review of his health history and lifestyle, we found that it was due to a gut and an immune problem. We found he had underlying food sensitivities that were causing his swelling in one knee, not what you'd expect. We helped him lower his inflammation, heal his leaky gut, and come up with food choices that worked for him that did not throw his immune system and his body out of balance. Now he is riding his bike again, long distances, and he is happy and without pain and without swelling. Maybe you're like Angela. Angela suffered from extreme fatigue, from poor focus, as well as debilitating headaches. Despite the medication she was taking, these headaches forced her to have to lie down several times a week in a dark room, and she did this for a 10-year period. Due to these headaches, she couldn't work as often as she needed to, and it broke her heart because she couldn't spend time with her husband and her young kids as she wanted to. But by working through our program, we were able to help address the root cause of her headaches so she could go back to being productive at work again and spend quality time again with her family. Now realize that your participation today could be transformational. I am sure that you understand the difference between wanting to go to the gym, talking about it, and actually going to the gym and getting a workout in. I want to encourage you to fully engage and eliminate distractions such as TV or anything that would prevent you from focusing. I don't know about you, but I've been through many webinars in the past where I'm scrolling through the internet, listening to this information. It's all coming at me, but I'm not capturing it. Wishing I could scroll backwards and rewind, but these nuggets are going past me and I'm not capturing them and I'm not getting out of it what I could be. I share this because I don't want you to miss out on the potentially life-changing opportunity that I'm going over today. Now, have you ever taken a course or gone through a class and not applied what you learned? Well, if the information I present to you resonates with you, then does it make sense that I give you an opportunity to take action so that you can get the best results from it possible? Okay, great. Now, how many people have autoimmunity? Well, autoimmune cases are skyrocketing both in the US and in the world. 16% of Americans, or 50 million people, have been diagnosed with an autoimmune condition, and that means many more have gone undiagnosed. 78% of cases are women, or 4 out of every 5. Cases are rising globally at a rate of 3 to 9% per year, depending on where you live. Now, since our genes haven't changed, the rise is thought to be due to environmental and lifestyle influences. There are over 100 named autoimmune diseases. Some of the most common include lupus, rheumatoid arthritis, multiple sclerosis, Crohn's, ulcerative colitis, celiac, Hashimoto's, Graves' disease, Addison's, Sjogren's syndrome, psoriatic arthritis, type 1 diabetes, Guillain-Barré syndrome, pernicious anemia, myasthenia gravis, and many more. How serious is it? How bad can it get? Well, if you have one autoimmune disease, you're likely to have others because the immune system, once it can no longer tell the difference between self and non-self, meaning between you and an invader, if it is left unchecked and given enough time, it will continue to branch out and attack other body parts. This is very important because healing will not come from merely treating symptoms of this condition. It will only come from addressing the problem at the root level. How serious is it? How bad can it get? Autoimmune diseases can be crippling. Due to pain, joint or nerve damage, many lose strength, they lose coordination, they lose balance, the ability to walk, and they end up using canes, walkers, or wheelchairs. Sadly, they lose the ability to perform daily functions, and they can suffer from brain fog, poor focus, or debilitating fatigue, causing them to have to lie down and sleep way more than an average person. Permanent damage can occur in the joints, in the brain, the intestines, thyroid, or any other organ that's being attacked. Although autoimmune diseases are rarely deadly, they can contribute to earlier mortality by causing a variety of comorbidities or other conditions that can worsen health. Some autoimmune diseases can affect the ability to get pregnant, and they can have adverse effects on pregnancy itself. This is why it is recommended to wait until you're in remission if you have an autoimmune disease before you try to conceive. Now, how did I, as a chiropractor, get interested in working with autoimmunity? Well, back in 2015, after playing soccer for 34 years, getting my first degree black belt in Taekwondo, finishing 4 sprint triathlons, I thought I was in the best shape of my life. But being physically fit is not the same as being overall healthy. Remember I mentioned to you my experience as a little kid with asthma, colds, flus, allergies, and then as an adult with the 3 concussions and the divorce-related stress? Well, that all came to a head in the next moment that I'm going to share with you now. One afternoon, I was driving with my daughter. She was in the passenger seat, and I'm holding onto the wheel. We pulled up to a light, and everything went white for me. I felt like my heart was about to stop. I felt like I was blacking out. And before I knew it, I came to, and my heart was pounding on the inner wall of my chest really intensely, and that basically woke me up. And I thought to myself, what in the world just happened? My daughter's sitting next to me. She had no idea that anything had gone wrong. And then as a result of that, I spent 5 hours that night in the emergency room in downtown Chicago. They did every test that they could possibly think of, and they found nothing. They said, you have the body of an elite athlete. And I said, I don't feel very elite right now. Over the next several weeks, I went another 5 times to the emergency room because I thought I was having heart attacks. My heart would race. It would slow down. It would sputter. It would flutter. It would skip beats. I would feel tension. I would feel anxiety. I would feel all these different things. And frustrating to me was the fact that these doctors would start to think that it was all in my head. I couldn't believe that they would start to say, oh, this must be panic related. Are you sure you're not just under a lot of stress? I'm like, no, this is not stress. This is not a normal thing that happens to people. You don't feel like you're having a heart attack. You don't nearly white out and have these incredible flutterings going on in your heart. I didn't know what else to do. And thankfully, an angel appeared to me in the form of a friend who said, hey, you need to continue to look into this from the functional medicine side of things. I'll share more about that in a minute. But these doctors finally found what was wrong with me after they looked at all these different symptoms that I was having. I had an irregular heartbeat. I had sore throat. I had neck pain, headaches, vertigo, abdominal pain, intestinal upset, extreme fatigue, random violent shivering, warm and cold sensations on my skin, dry eyes, dry mouth, night sweats, and random fevers that were unrelated to any infection. I had weakness in my extremities. I had cold hands and feet, abdominal and neck rashes, brain fog, hair loss, earwax buildup, dandruff, insomnia, and poor memory. After many imaging and blood tests were done, I found that I had Hashimoto's thyroiditis, or autoimmune thyroid, just like Paige that I mentioned before. But labeling a disease does not heal the disease. The question remains, how do you stop the immune system from attacking your own body? And unfortunately, I also found that I had autoimmune activity in 6 other organs. This freaked me out. It reminded me how miserable and unhealthy my patients were if they were taking immunosuppressant drugs for their own autoimmune condition. I didn't want that because I knew drugs were only going to help me suppress symptoms and they won't help me get my life back. I only wanted to pursue solutions that fix the underlying problem. So what did they recommend I do? The only solution I was given at the time was to take a heavy dose of thyroid medication. And I said, excuse me? That's it? That's all we're going to do is address the damage, the lower thyroid numbers caused by the damage to the thyroid gland? What about all these attacks going on in my body from the immune system? What's going to stop the problem at the root level? And nobody had that answer. This medication made me feel a little better, but it did not address why the immune system had gone rogue in the first place. It was then that I learned about functional medicine. And this friend that I mentioned, who was an angel to me, encouraged me to dive headfirst into studying everything I could about functional medicine. So that's what I did. So what is functional medicine? It is an approach to healthcare, like chiropractic, that looks to promote health from within, to find the root cause of poor health rather than only treating the symptoms of disease. Symptoms are like a fire alarm, and disease is like the fire. Now you can feel better by addressing the fire alarm, pulling the batteries out of it. But the symptoms are just that. They're looking at the effect. And the fire, which is the actual cause, needs to be addressed. That's what's triggering the fire alarm in the first place. Functional medicine approaches the whole person, looks at from a whole body perspective, and uses lifestyle and nutritional recommendations to stimulate change, to stimulate healing, and to address the internal dysfunction that is causing poor health in the first place. I found it to be an essential complement to my existing chiropractic program that I gave my current patients. Now, 7 years later, thankfully, gratefully, my autoimmunity is in remission. I have regained my health, I am active and fit again, and I was able to earn a 2nd degree black belt in Taekwondo. I have also had the privilege of leading many others down this path to healing and recovery. Now, to me, I see that as being the gift. My suffering has been turned into a gift because now I can share this information with you and with others so that hopefully you can avoid going down that same path of suffering and prevent damage to your body before it's too late. Now, I want to emphasize to you that my role as a chiropractor and a functional medicine doctor is not to cure a specific disease like autoimmunity. It is to help the body heal and function at its full potential regardless of what condition or disease that you have. We do this by resetting the communication pathways between the brain and the body, by providing your body what it needs, removing that which is toxic, and allowing the body to heal itself. I hear about so many people in my community suffering like I did 7 years ago. They don't know that our approach exists or where to turn to find it, and they're only presented with pharmaceutical options. I see what we do helping people every day in my practice, and that's why I feel it is my duty to get the word out. So how do you know if you have an autoimmune disease? What are some common symptoms? Well, in the joints and muscles, you might find muscle aches, joint pain and swelling, muscle weakness and inflammation. Skin-related symptoms might include rashes, itching, dry eyes, dry mouth, dry skin, inflammation or hair loss. In the digestive tract, you might have bloating, gas, constipation, diarrhea, abdominal pain, acid reflux, indigestion, nausea, food sensitivities, and blood or mucus in the stool. In the nervous system, you might have dizziness, vertigo, headaches, anxiety and depression, confusion and difficulty thinking, blurry vision, insomnia, memory issues, migraines, lightheadedness, numbness and tingling, or brain fog. Other general symptoms of autoimmune disease include fatigue, pain, unexplained fevers, chest pain, swollen glands, weight gain or loss, rapid or irregular heartbeat, shortness of breath, or temperature sensitivities. Now, how do you diagnose autoimmunity? Well, blood tests are used to detect the presence of autoimmune antibodies. Also, you might have imaging studies such as ultrasound, X-ray, or MRI used in some cases, depending on what you need. According to the American Autoimmune-Related Diseases Association, the average time it takes to achieve a diagnosis of autoimmunity is 4.5 years. That means from the time you have symptoms and you report them, it takes 4.5 years on average, which means some people take even longer before they can get a diagnosis and get working on potential solutions. UVA Health says that patients have typically seen 6 doctors before they get a diagnosis. This gives you an idea of how confusing and difficult it can be to find your way out once you start developing autoimmunity. Again, making it very important to address it from a proactive, improve your health from within standpoint. What are the mainstream medical approaches to autoimmunity? Well, the medical approach uses pharmaceuticals to suppress the immune system, to shut it down, as well as to treat symptoms. In the short term, these can be very effective, but this masks the underlying problem and can leave one more vulnerable to things like infections and cancer. Unfortunately, the effect of these drugs wears off over time and they carry some significant risks. One approach is with a category of drugs called biologics, like Humira and Remicade. These are 2 very popular ones. They carry risks, though, ranging from mild to life-threatening, such as acne, fatigue, hair loss, hair growth, headaches, poor concentration, high blood pressure, mouth sores, osteoporosis, tremors, weight gain, nausea and vomiting, and diabetes. They also leave you vulnerable to blood, fungal, skin, and respiratory infections. Biologics are very expensive, with an average annual cost at around $40,000 per year per patient. They've also only been found to be effective 25% of the time. Over the first 5 years, 50% of patients drop out from treatment. Over the first 8 years, 80% of patients withdraw. Only 11% of patients taking these drugs achieve sustained remission of their autoimmunity at the 5-year point. Another common autoimmune drug is methotrexate. It is from a category of drugs called disease-modifying antirheumatic drugs, aka DMARDs. Methotrexate prevents DNA and RNA synthesis in an effort to shut down the immune system. It carries high risks, though, including liver toxicity, serious or life-threatening skin reactions, malignancy, and bone marrow suppression. Others report nausea, vomiting, mouth ulcers, headaches, and fatigue. 36% of those treated stop because of adverse events during treatment. Other treatment options include steroids. These are anti-inflammatory drugs with significant side effects, including osteoporosis, diabetes, hypertension, delayed wound healing, increased risk of infection, and mood changes. Steroids and steroid injections can damage any type of tissue that they touch. Pain medications are often prescribed for obvious reasons for autoimmune conditions, but they are toxic to the liver and the kidneys. The category of anti-inflammatory drugs and pain meds called NSAIDs, which includes naproxen, sodium, Advil, Aleve, ibuprofen, and aspirin, can be effective for acute short-term relief. But long-term use of these can have a contributing factor to autoimmunity by causing leaky gut, worsening the very autoimmune condition that they're trying to help. In the US, they also contribute to 100,000 hospitalizations and 16,000 deaths per year. The biggest concern with these pharmaceutical approaches is that none of them address the underlying cause of autoimmunity, which allows the autoimmunity to keep getting worse. So what causes autoimmunity? Genetic predisposition can increase your risk, such as having family members with certain autoimmune diseases. But genes are not your destiny. Genes get turned on or activated, or turned off, deactivated, by triggers in our environment and lifestyle. This effect of our environment and lifestyle on genes is called epigenetics. Family members often live a similar lifestyle, and they live in the same environment, and this then contributes to turning on and turning off certain genes, some of which can lead to autoimmunity. Medications can cause autoimmunity. While not all meds in the following categories cause autoimmunity, some antidepressants, some statins, some high blood pressure meds, some antibiotics, and some anti-seizure meds are known to increase your risk. Smoking can increase your risk. Having one autoimmune disease also increases your risk of developing another. Because your immune system's gone rogue, it's attacking your own tissues, that can lead to a spillover effect of it attacking other parts of your body. Being female is a risk factor. Having obesity or having certain chronic infections can cause a higher risk of developing autoimmunity. Now here's what people don't know. Science has not identified a single cause of autoimmunity. I encourage you to be wary of those who offer a single magic bullet for it. Any one or a combination of the following can be a cause of autoimmunity: bacterial or viral infections, toxicities, certain drugs, poor diet, chronic stress, an unhealthy lifestyle, as well as genetic predisposition. Underlying chronic infections such as Lyme disease, mono, strep, or gingivitis can fatigue and confuse the immune system and push it out of balance. Imagine these viral particles embedding themselves in a cell and causing the immune system to go after it. Now the immune system is going to identify that cell and the virus itself as an invader, as a threat. They'll start to develop antibodies against both. And that's part of the way that mechanism works. Chronic stress in the brain and body can be a factor, shifting the body into chronic fight or flight mode, which causes disorder in the immune system because the body is in chronic defense mode against a threat. It's in survival mode. All the energy is shifted into the defense of the body and away from repair, rebalancing, and rebuilding. The immune system needs repair and rebalancing, and if it's not getting it, it can start to shift out of balance and then start to attack your own body systems. Unresolved inflammation in one part of the body, such as from a chronic injury in your spine or a joint, can contribute to autoimmunity by causing an increased circulation of inflammatory chemicals in the entire body. So imagine those chemicals released from an injury, say from your elbow, from your spine, or even from your gut, can lead to a distribution of these inflammatory chemicals in your whole body, signaling and triggering an activation of your immune system everywhere. That can drive your immune system out of balance. Also, toxicity can drive autoimmunity. Environmental or foodborne toxins that come into our body that we're exposed to can build up, not just in your liver, but also in your brain, in your intestines, in your fat cells, and elsewhere. And they can build up in your tissues. The immune system then starts attacking to try to remove or gobble up these toxins, But if those toxins are attached to your tissues, then the tissues also get attacked as well because they're bound to each other. Imbalances in your gut ecosystem of viruses or bacteria or other microorganisms can shift that ecosystem out of balance, with certain bacteria now being the dominant strain. They produce certain toxins. Those toxins of those unwelcome bacteria can cause leaky gut in the lining of your intestine, allowing those toxins to start infiltrating your blood, and then those toxins can circulate in your whole body. Other things that shouldn't get into the bloodstream can also get in through those leaks in your gut, contributing to triggering and irritating the immune system as a result as well. As you can see, there can be several different causes or triggers of autoimmunity, and it is so important to address as many of them as possible for true healing to occur. Here's what has worked for my patients and for myself. We start with a comprehensive health history. I need to know what you've gone through. I need to know what you've experienced. I need to review your major life events, your prior illnesses, your traumas, lifestyle patterns, and any environmental influences. We then perform a thorough examination, including advanced diagnostic testing, stool, saliva, or urinary tests, or advanced imaging, depending on what is needed in your case. We look for functional imbalances until we can identify what is and what is not working properly. We then meet to go over a functional initial intensive program that is customized to your needs to help your body calm down the fires of inflammation. Our goal at this stage is to shift your body out of stress mode, help the cells get the energy they need, and help you begin to heal. Once we've done the initial intensive phase and you have shifted into healing mode, we can then begin rebuilding in our restoration phase. We do this by providing your body what it has been missing from the essential areas of health. The important point here is that your program needs to be customized, whether that be addressing nutritional deficiencies, dietary composition, restoring gut health, addressing infections, balancing brain function, spinal alignment, detoxification, or increasing movement and strength. We will prepare a restoration program tailored to your needs. A major difference between mainstream medicine and our approach is that we do not treat symptoms and we do not suppress body functions. Most medications do just that. They aim to suppress symptoms or control the body from the outside. The problem is that medications compete with the body's innate ability to control itself. Our approach focuses on being the detective to determine what the body's missing, to provide that, and remove what it doesn't need so that your natural healing ability can go to work. Now, what makes me so passionate about helping my patients? Let me tell you a story. One of my patients, a lovely woman and mother of 3 kids, despite all my urgings, didn't want to eat a healthy diet. She didn't want to eat vegetables, especially the green ones. She was always stressed out, always in a rush, and she said she didn't have time to meditate. She developed lung cancer, which was strange because she wasn't a smoker. Her cancer had spread from her lungs to her brain, and we knew her days were numbered. And during one visit, in a moment I'll never forget, she looked at me with tears in her eyes and said that she wasn't ready to die, that she wasn't ready to go. Now, I know this is not an autoimmune case, but her death shaped me. While there are many causes of cancer, I know, some known, some unknown, we do know that lifestyle and environmental factors count for 90 to 95% of cancer cases. Sadly, her motivation came too late, and I wish I had known then what I know now. I believe that if she had followed a healthier lifestyle for more years, that she would have fared better. Seeing her in that desperate moment of regret taught me that I needed to speak up and to lead others to view life and their health as precious, to take better care of themselves along the way and not wait for symptoms and disease to be diagnosed, and to break down proactive changes into bite sizes that anybody could follow. You have the power to choose what you do to take care of yourself, your own health, and that of your family. Consider how you would feel in 6 or 12 months from now if your condition got worse. Would you wish you had done something to avoid getting to that point? Now, what if you made your health a priority right now and you do everything in your power to regain it? Imagine how rewarding it would be if in 6 or 12 months, when you feel great, you have your health back and you're doing all the things that you want to do again. What I'm not offering today is an invitation to come sit in my waiting room for an hour, sit with me for 5 minutes while I'm staring at my computer, and to come away with a list of medications. What I am offering, though, is an opportunity for your health and your life to go down a different path. It is an offer to meet with me for a focused one-on-one, a no-charge 15-minute discovery call, where you will share with me your health challenges and your goals, and you and I can determine if we're a good fit to work together. If we decide that we are, then we can move forward with a new patient appointment, get to the bottom of what got you to the present state, and chart a course for healing. Here's how we do the online scheduling. Just click the link on the screen that says book a call, or in your browser you can enter wholebodyhealthforme.com/call. That's wholebodyhealthforme.com/call. That will take you right to my online scheduler, and you can pick a time for your discovery call. If you have other questions on what I cover, please email me at drdave@wholebodyhealthforme.com. That is drdave@wholebodyhealthforme.com. And I will get back to you ASAP. First question: can taking nutritional supplements and vitamins cause more harm than good? Now, this is a great question, because before we recommend that you take any nutritional supplements or recommend any dietary changes, we need to make sure that your situation calls for that. We will help you meet those needs whenever possible with foods first, and then with nutritional supplements when needed. We also must review any contraindications to what you're taking so that we are not interfering with other medications or other issues your body is currently having. Finally, we only recommend the highest quality supplements to help you make sure you're getting the nutrients that you actually need. Second, why are autoimmune cases rising so rapidly? Well, while human genes have not changed over the past 100 years, our environment and lifestyle have changed dramatically. Wouldn't you agree? Humans are routinely exposed to more than 80,000 man-made chemicals in our environment, from plastics to antibiotics, cleaners, and herbicides. Few of these chemicals have been tested for safety. Humans consuming modern diets ingest more artificial ingredients, more sugar, and fewer fruits and vegetables, providing less nutritional benefit, more toxic exposure, and contribute to an unhealthy gut and internal environment. Modern living involves more sitting in front of phones, computers, and devices, less exercise, and our stress levels are through the roof. These are just a few of the reasons, few of the factors contributing to the rise of autoimmune disease. Third question: what if I have an eating disorder and I'm given recommendations for food restrictions that I cannot follow? Well, the short answer is that we will work closely with you to make sure that our recommendations are appropriate and customized for your needs. It is essential to your success in our functional medicine program that you are thorough and transparent in providing us with all relevant health information during your health history. We need to know what you can and cannot do. This information is critical to shaping a customized program that you can successfully follow. No two people are exactly alike, and neither should be your care plans. Fourth, are autoimmune diseases curable? No. At present, it is thought that the best outcome is remission, when the immune attack calms down and it becomes dormant. Medications can help with this over the short term in some cases, but they are risky, expensive, and lose effectiveness with long-term use, just as we explained before. On the other hand, we can also achieve remission in many cases by taking the root cause approach, by addressing the following three components, which are key to regaining your health over the long term. We have to address the drivers of autoimmunity. We need to provide the body the nutrition, the lifestyle, and environments it needs in order to regain proper function. And thirdly, we need to decrease its toxic load. These three components will help restore the body's ability to heal and recover function, as they did for me and for so many of my patients. I look forward to every time I meet someone new, especially when they are frustrated from being misdiagnosed, or worse yet, when they are told that their symptoms are all in their head. I get really excited when I hear that because I know this person's life is about to change for the better. If you haven't signed up yet, I encourage you to follow the link in the chat box. Make your appointment, and I will see you at your discovery call. Thank you so much for being here.